The question you bring is a heavy one, carried by many in silence. You ask for ways to change your physical form, but the true journey is about changing your perception of self. The answers you believe you are looking for are not the ones that will bring you peace. Stay with me, for the final secret we uncover has nothing to do with measurement and everything to do with meaning. Perceiving form. We live in a world of measurement, of comparison. From a young age, we are taught to quantify everything: our successes, our wealth, our worth. It is only natural that this mindset extends to the way we view our own bodies. We are given images and ideas of what is considered ideal, and we measure ourselves against this external, often unattainable standard. The question of physical size stems from this place of comparison, from a feeling of less than. It is a shadow cast by an idea, and we become lost in chasing this shadow, believing that if we could just grasp it, if we could just change this one aspect of ourselves, then the feeling of inadequacy would vanish. But the shadow is not the source of the problem. The source is the light and the object that blocks it. The source is the mindset of comparison itself. Before we explore the science of the physical body, we must first sit with the mind. This anxiety, this preoccupation with a single measurement, is a form of suffering. It consumes mental energy, it erodes confidence, and it distracts from the qualities that hold true value: our character, our kindness, our presence. The world will always present us with new standards to meet, new reasons to feel less than. If it is not this one measurement, it will be another. The chase is endless, a cycle of desire and disappointment. The only way to find freedom is to step off this path altogether. It begins by turning our attention inward, away from the external yardstick and toward the internal landscape of our own being. When we seek to change the body because of a feeling of inadequacy, we are giving our power away to an external idea. The path to true confidence is not to change the body to fit the idea, but to change the idea so that it aligns with the reality of who we are. This is not to dismiss the physical form, but to put it in its proper context. The body is our vessel, our temple, and we should care for it with great respect. There are indeed ways to optimize its function and its appearance, to bring it to its fullest and most vital expression. And interestingly, the path to achieving this often leads to a natural improvement in the very thing that is causing distress. There are scientific, evidence-based principles that a urologist would confirm, which can alter the perceived length of the body. Notice the word perceived. So much of what we experience is shaped by our perception. A mountain appears small from a great distance, yet massive when we stand at its base. The same is true for our own form. Two key factors grounded in simple anatomy and physiology influence this perception. The first is the state of the tissues and their ability to achieve their full potential. A vessel that is filled to its capacity will appear larger and more robust than one that is not. This is a matter of circulatory health, of ensuring that the intricate network of blood vessels is open and responsive, allowing for the maximum flow of life-giving energy. When the system is healthy, the potential for fullness is realized. The second factor is how much of the form is visible to the eye. Often, a significant portion of the penile shaft is not external but resides within the body, anchored to the pelvic bone. Its appearance can be obscured by the tissues surrounding it, particularly the pad of fat that rests just above the pubic bone. These are not illusions, they are anatomical realities. By addressing these factors, we are not performing magic. We are simply bringing the body into a state of optimal health and allowing its natural, true form to be fully expressed. This journey is not about adding something new, but about uncovering and revitalizing what is already there. Uncovering potential. The path to revealing the body's full potential is not through a magic pill or a strange device, but through the dedicated and patient cultivation of overall health. It is a journey of subtraction, not addition. It is about removing the obstacles that obscure our natural form and inhibit its vital function. The first and most impactful of these obstacles for many is excess body weight. From a purely urological and anatomical standpoint, the connection is direct and undeniable. The penis has a root deep within the pelvis, anchored by a structure called the suspensory ligament. A significant portion of its total length is internal. Above this area lies the suprapubic fat pad. When a person carries excess weight, particularly visceral fat around the abdomen, this fat pad becomes larger and thicker. It essentially buries the base of the penile shaft, creating a tethering effect and making what is visible appear shorter. Think of an iceberg. A great portion of its mass is hidden beneath the surface of the water. What we see is only a fraction of its true size. The suprapubic fat pad is like the water level. As the water level rises, less of the iceberg is visible. As the water level falls, more of the iceberg is revealed. Losing weight, specifically body fat, is the process of lowering that water level. Scientific studies have confirmed this relationship. For every 10-15 kilograms, about 22-33 pounds, of weight lost, one can expect to uncover approximately 1 centimeter, about 0.4 inches, of penile length that was previously hidden. This is not a change in the actual size of the organ itself, but a change in its effective visible length. This is a powerful realization. It means that for many, the more they are seeking is already present. It is simply veiled. The work then is to gently and consistently remove the veil. This process should not be one of extreme or rapid weight loss, which can be harmful, but a gradual, sustainable lifestyle change centered around a balanced diet and regular physical activity. This brings us to the second pillar of uncovering our potential, nurturing our cardiovascular system. The health of our heart and blood vessels is paramount. An erection is a purely hemodynamic event. It is the result of blood flowing into and being held within the erectile tissues. The quality, firmness, and even the perceived size of an erection are directly dependent on the health of this system. When our arteries are narrow and stiff due to conditions like atherosclerosis, high cholesterol, or high blood pressure, blood cannot flow freely. The tissues cannot become fully engorged, leading to weaker erections that may lack the fullness and size they would otherwise have in a state of peak health. Everything that is good for your heart is good for your penile health. This is a fundamental truth in urology. Embracing a diet rich in fruits, vegetables, whole grains, and lean proteins can have a profound impact. Foods high in nitrates, such as leafy greens like spinach and arugula, as well as beets, can help the body produce more nitric oxide, a crucial molecule that relaxes and dilates blood vessels, improving blood flow. Regular exercise, from brisk walking to more intense cardiovascular training, strengthens the heart, improves circulation, and helps maintain a healthy weight. Conversely, habits like smoking are devastating to vascular health. The chemicals in cigarette smoke damage the delicate lining of the blood vessels, causing them to constrict and leading to impaired blood flow throughout the entire body, including the penis. Therefore, quitting smoking is one of the most powerful steps one can take. By focusing on these fundamental principles, managing weight and optimizing cardiovascular health, we are not just chasing a number. We are cultivating a state of profound well-being that allows our entire body, including this specific part of it, to express its full, healthy, and natural potential. Questionable methods. The path to well-being is often quiet and patient. It requires discipline and consistency. Yet the modern world constantly presents us with shortcuts, with promises of instant transformation through external means. When a person is feeling vulnerable and insecure, they become susceptible to these promises. The market for penile enlargement products is vast, built upon the exploitation of this deep-seated anxiety. It offers an array of pills, creams, strange contraptions, and surgical procedures, all claiming to deliver the one thing that is desired most: more size. As a guiding voice, it is my responsibility to illuminate this path with the light of science and reason, so that you may see it for what it truly is. Let us speak first of the potions and pills. There is no cream, lotion, vitamin, or herbal supplement that has ever been scientifically proven to increase the physical length or girth of the penis. This is an unequivocal fact. The anatomical structure of the penis is not like a muscle that can be fed to grow. Its size is determined by genetics and hormonal development during puberty. These products often contain ineffective ingredients, or in some cases, unlisted and potentially harmful substances. They are distractions from the real work of holistic health. Then we come to the mechanical devices, such as vacuum pumps and traction devices, also known as penile extenders. Here, the scientific landscape becomes slightly more complex, but the guiding principles of caution and wisdom remain. Vacuum erection devices work by creating a seal around the penis and using negative pressure to draw blood into it, creating an erection. They are a legitimate medical treatment for erectile dysfunction, but they do not produce any permanent increase in size. Any perceived increase is temporary due to the swelling and blood engorgement and dissipates shortly after the device is removed. Prolonged or improper use carries risks, including bruising, numbness, and damage to the tissues. It is a tool for function, not for permanent augmentation. Penile traction devices are more complex. These devices are worn for several hours a day over many months and apply a gentle, constant stretching force. The theory is that this sustained traction can stimulate tissue growth through a process called mechanotransduction. A small number of clinical studies have investigated these devices. Some of these studies have shown modest, and I stress the word modest, increases in flaccid length, typically in the range of 1 to 2 centimeters, after 4 to 6 months of rigorous use for at least 4 to 6 hours every single day. However, the evidence is not strong. The studies are often small, lack proper control groups, and have high dropout rates because the process is cumbersome, uncomfortable, and time-consuming. There is little to no evidence that they increase erect length, which is the primary concern for most men. Furthermore, there are significant risks, including pain, nerve damage, tissue tearing, and even Peyronie's disease, the formation of scar tissue that can cause a painful curvature. To commit to such a demanding and risky regimen for a very small potential change in the flaccid state is a path that one must consider with extreme caution. It represents a deep investment of time, energy, and risk, all while focusing the mind on the very measurement that is the source of the suffering. It is an attempt to force the body to change through external means, rather than allowing its potential to unfold naturally from a place of inner health. This path can lead one further into the cycle of obsession and dissatisfaction rather than out of it. Finally, there is the path of surgery. Procedures like suspensory ligament release, where the ligament anchoring the penis to the pubic bone is cut to allow more of the shaft to hang externally, may offer an increase in the perceived flaccid length. However, this often comes at a cost. Cutting this ligament can lead to a loss of stability in the erection, causing it to point downwards rather than upwards. The increase in erect length is typically minimal, if any. Other procedures, such as injecting fat or dermal fillers for girth, are fraught with risks of lumpiness, scarring, deformities, and loss of sensation. These are invasive paths, attempts to sculpt the temple with a chisel in a way it was not meant to be sculpted. They carry irreversible consequences and should be seen as a last resort for extreme cases, not as a solution for common anxiety. The wise path is to turn away from these external methods and instead turn inward. True stature, we have journeyed far. We have examined the mind, the body, and the many false paths that promise to solve a problem that is not what it seems. We arrive now at the final, most important destination. It is the understanding that the relentless pursuit of a physical measurement is a distraction from the cultivation of true stature. True stature is not something that can be measured with a ruler. It is a quality of being. It is the confidence that emanates from a person who is at peace with themselves, who walks their path with integrity and purpose. It is the strength that comes not from the size of one's body, but from the stillness of one's mind. A tree may be tall, but if its roots are shallow, the first strong wind will fell it. A man may seek to augment his physical form, but if his spirit is small, he will forever feel inadequate. The work, then, is to cultivate these deep roots. It is the daily practice of turning your attention away from the chatter of comparison and judgment, and toward the quiet whisper of your own breath. It is the discipline of nourishing your body, not to change its dimensions, but to honor it as a sacred vessel. It is the courage to be present with your partner, to connect on a level of emotional intimacy and vulnerability that transcends the purely physical. This is where true connection lies. Your partner is drawn not to a measurement, but to your presence, your attention, your kindness, and the safety they feel in your energy. No physical attribute can ever replace the power of a man who is truly deeply present in the moment. This is the quality that creates unforgettable intimacy. This is the quality that builds unshakable confidence. This journey is about redefining what it means to be powerful, what it means to be a man. It is to move beyond the shallow definitions offered by a world obsessed with surfaces. It is to understand that your worth is not and has never been tied to a number. It is inherent, it is absolute. The anxiety you feel is a call to awaken, a signal that you are placing your value in something fragile and external. Heed this call. Use it as motivation to begin the real work, the inner work. Cultivate a strong mind and a healthy body. Practice kindness and compassion, first for yourself and then for others. Learn to find stillness in a world of noise. Stand in your own truth. True stature is built from the inside out. It is the peaceful strength in your eyes. It is the calm confidence in your voice. It is the grounded way you walk through the world. When you cultivate this inner reality, the anxieties about your outer form begin to fade. They are seen for what they are: ghosts, shadows, illusions that held power only when you believed in them. Stop chasing the shadow and become the source of your own light. This is the only path that leads to the lasting peace and unshakable confidence you truly seek.